Maya stared at the hospital's emergency department through the glass doors, her hands trembling as she clutched her newly printed ID badge. 3 months out of nursing school, and tonight would be her first solo night shift. The seasoned nurses had all called in sick with the flu, leaving her as the only registered nurse on duty with Dr. Patel and 2 medical assistants. "You've got this," she whispered to herself, but the words felt hollow. She'd barely survived her training rotations, always needing guidance, always second-guessing herself. How could she possibly handle an entire emergency department alone? The automatic doors whooshed open, and she stepped into controlled chaos. The waiting room buzzed with worried families, crying children, and the constant hum of medical equipment. Dr. Patel rushed over, his usually calm demeanor replaced by barely contained panic. "Maya, thank God you're here. We've got a multi-car accident coming in. 5 victims, ETA 7 minutes. I need you to prep Trauma Bay 1 and set up for possible surgery." Her heart hammered against her ribs. I've never." "You trained for this," Dr. Patel interrupted, already moving toward the supply closet. "Trust your training." As Maya rushed to prepare the trauma bay, her mind went blank. What came first? Monitors. For setup. Intubation kit. The textbook procedures she'd memorized seemed to evaporate under pressure. But then muscle memory kicked in. Her hands moved automatically, setting up equipment in the exact sequence her clinical instructor had drilled into them hundreds of times. The ambulance sirens wailed in the distance, growing louder. Through the radio, she heard the paramedics report: critical patient, male, approximately 30, possible internal bleeding, vitals dropping fast. When the doors burst open and the paramedics wheeled in the first victim, Maya felt time slow down. The man's face was pale, his breathing shallow. Blood soaked through the temporary bandages on his abdomen. "Bay 1. Dr. Patel shouted, but he was already working on another victim in Bay 2. Maya found herself alone with the critical patient. The monitors screamed warnings as his blood pressure plummeted. She knew she had maybe minutes before he went into shock. Think, Maya. What would Mrs. Henderson do? Her favorite instructor's voice echoed in her mind: "Trust your assessment. Your eyes and hands know more than you think." Maya's training took over. She quickly assessed his airway, clear but labored breathing. Circulation, weak pulse, dropping BP. She started 2 large bore 4s, began fluid resuscitation, and called for blood typing. Her hands worked with surprising steadiness as she applied pressure to the bleeding wound and prepared for the doctor. But Dr. Patel was still tied up with another critical case. The man's eyes fluttered open, unfocused and afraid. "Am I going to die?" he whispered. Maya looked into his eyes and felt something shift inside her. This wasn't about her fears anymore. This was about him, about keeping him alive until help arrived. "Not on my watch," she said firmly, surprising herself with the conviction in her voice. "I'm Maya, and I'm going to take care of you. What's your name?" "James," he gasped. "Okay, James. I need you to stay with me. Tell me about your family." As James weakly described his wife and 2 young daughters, Maya continued her interventions. She noticed his breathing becoming more labored and realized he might have a pneumothorax, a collapsed lung. She'd only done needle decompression on training dummies, never on a real person. Her hands shook as she prepared the needle. What if I miss? What if I make it worse? But James's breathing grew more desperate, and she heard Dr. Patel's voice from across the room. "Maya, trust yourself. You know what to do." She palpated James's chest, found the anatomical landmarks exactly as she'd been taught, and inserted the needle. The immediate rush of air and James's relieved breathing told her she'd done it correctly. Over the next hour, Maya found herself managing not just James, but coordinating care for 2 other patients when the medical assistants became overwhelmed. She started 4s on a dehydrated elderly woman, sutured a deep laceration on a teenager, and somehow managed to keep track of medications, vitals, and documentation for all 3 patients. When the backup staff finally arrived at 2 a.m., Maya was still going strong. Dr. Patel pulled her aside as the chaos began to settle. "Maya, I need to tell you something," he said, his voice filled with admiration. In 20 years of emergency medicine, I've rarely seen a nurse handle her first solo crisis with such skill and composure. You saved James's life tonight. That needle decompression. Perfect technique, perfect timing. Maya stared at him in disbelief. But I was terrified the whole time. I kept thinking I didn't know what I was doing. Dr. Patel smiled. Fear doesn't make you weak, Maya. It makes you careful. It makes you think. But tonight you proved something important. You're braver than you believed possible, stronger than you appeared to yourself, and much smarter than you gave yourself credit for. Later, as Maya sat in the break room at 6 a.m., exhausted but somehow energized, James's wife found her. The woman's eyes were red from crying, but her smile was radiant. The doctor told me what you did, she said, gripping Maya's hands. You saved my husband. You gave my daughters their father back. Maya felt tears spring to her eyes. 3 months ago, she'd almost quit nursing school, convinced she wasn't cut out for this. Her instructors had seen something in her that she couldn't see in herself. 6 months later, Maya became the youngest charge nurse in the hospital's history. She never forgot that night, not because it was when she proved herself to others, but because it was when she finally discovered who she really was. The lesson she carried forward wasn't that she was fearless, but that courage isn't the absence of fear, it's acting in spite of it. She wasn't the strongest person in the hospital, but strength isn't about physical power. It's about endurance, persistence, and the will to keep going when everything seems impossible. And she wasn't the smartest person with the most medical knowledge, but intelligence isn't just about what you've memorized. It's about trusting your instincts, learning from every situation, and having the wisdom to know when to act and when to ask for help. Maya kept a photo on her desk of James with his family, all of them healthy and smiling. Whenever new nurses came to her feeling overwhelmed and underprepared, she would tell them the same thing Dr. Patel had told her that night. You're braver than you believe, stronger than you seem, and smarter than you think. Sometimes it just takes the right moment to discover it. Because sometimes, the person we need to become is already inside us, waiting for the moment when we finally stop doubting and start trusting ourselves. Thanks for watching. Kindly like and subscribe.